Thrive Functional Neuropathy Center, Natural Neuropathy Solutions, are 3 steps to reversing neuropathy now. Presented by Dr. Gray Rappy, a certified functional medicine practitioner, completed a board certification course in neuropathy, and board eligible in nutrition. Hi, my name is Dr. Rappy. Let me give you a little background on myself. I graduated from school with my doctorate degree in 1989, and since that time I've really traveled across the country extensively, studying with and training with other functional medicine doctors, receiving postgraduate studies in functional medicine, functional endocrinology, functional immunology, functional blood chemistries and metabolic testing, as well as functional nutrition, to name a few. I've completed a board certification course in neuropathy, so I treat it as a subspecialty in my office. Our goal really is to how to get lasting relief from pain, numbness, tingling, burning, cramping without drugs and surgery. And we really want our clients to thrive again, not just survive. Neuropathy is progressive, meaning that it will only get worse unless you take proactive steps to reverse it now. Very straightforward. I developed neuropathy myself many years ago when I first got out of school with my doctorate degree. I'd literally put my health on the back burner for almost 4 years. I was a world-class athlete in incredible shape entering school, and not so much when I left school. 50 pounds overweight, high blood pressure, high cholesterol, under a lot of stress, and a full-blown diabetic. So what I really did is I took a look at myself and said, look, I've got all of this education. I need to learn how to handle this on my own. So I implemented all the modalities that I have in my office, everything from high-powered laser treatments, decompression treatments. Nutrition was huge. Certain supplements that were really missing in my diet. And so I really was able to reverse my neuropathy. It took about 6 months, and I was completely reversed my underlying diabetic issues. I was a type 2 diabetic. After about 6 months, numbness and tingling were 2 of the main things that I had. They were gone within 6 months. I was back to exercising, lost 50 pounds, and I really turned my neuropathy around along with my diabetes. And I believe that at that point in time, it kind of dawned on me, hey, I think I'm onto something. And so over the next 30 years, what I've done is I've continued to fine-tune the program that we have in the office, which is proprietary only to my office. It's taught or offered nowhere else in the Coachella Valley. And so I've fine-tuned it over the years. We really have a super high success rate right now because we attack the neuropathy from multiple directions, as you're going to see in the video. We have a 3-step process, and the first step is for us to do a 16-point custom neuropathy examination, which is going to determine the client's level of loss, in this case 85% nerve damage. I use 85% because over the years I realized there was a lot of people that were coming to see me with neuropathy, and I needed to be able to pick and choose those individuals that I truly believe I could help. And I found with the testing that I do, if a person has less than 85% nerve damage, they're very successful in the program that I've put together, again, which is proprietary and offered nowhere else. I only accept those clients that I truly believe that I can help, and so I use this specialized testing to weed out those individuals who I don't think will be successful or we're not able to help. And I think that's just the honest way to approach what we're doing. Well, neuropathy is quickly becoming one of the most common chronic diseases in the United States. 8% of the U.S. population, about 24 million people suffer from peripheral neuropathy. I believe that number is really low compared to the number of people that actually have the beginning onsets of neuropathy. They don't realize the symptoms. They don't realize what's happening. They're not sure. No one's ever assessed them. They've never been tested. And so I believe there's a lot of people walking around out there that have peripheral neuropathy that are just completely unaware of what's going on. Peripheral neuropathy can occur at any age, but it's more common as we get older. And about 30% of peripheral neuropathy diagnoses are also linked to diabetes. And that was the case for me. So as you're watching this webinar, don't think that if I don't have diabetes, then I don't have neuropathy, and that's not true. Only 30% of the people we see out there with neuropathy are associated with diabetes. The 7 most common warning signs of peripheral neuropathy are pretty straightforward. Let's go through them. First, we have numbness, then we have tingling and prickling, we have burning pain. Sharp electrical shocks is one of the things I experienced late at night. I'd get these electrical shocks in my big toe that would make me jump out of bed. Balance problems and falls. Can't sleep because the symptoms are very common, and also cramping. So these are the top 7 that we see that present in our office with neuropathy.
Hi, I'm Michael Chambers, and I've had neuropathy. You know, neuropathy is a very insidious disease. It creeps up on you, and I discovered that I had it several years ago and spent several years trying to fix it, trying to get better, and it wasn't working. I finally found Dr. Rappy, and I decided it was time to really take it to the next level. I've been taking treatments now for 2.5 months, and it's improved by 50%, and I'm so grateful.
So if we look at these two wires here, this is just a representation of what's going on inside the body. You can imagine the electrical activity or the electrical flow or current through these particular wires isn't really what it should be. It's not up to snuff, so to speak, but this is really what's happening inside the body. The nerves have become dysfunctional, and we're not able to send nerve signals like we should, and that's why we do the specialized testing that we do. If those wires went to this toaster, today the toaster would work, tomorrow it wouldn't work. You'd find yourself wiggling the wire, hoping that you can make the electrical circuitry happen so that the toaster will work so you can go about your business. In some cases, when we have too much electrical activity in the nerves, what you'll find is it's very much like an extension cord that has too many power tools plugged into it. It'll get really hot, and in this case, the toaster is burning the toast. And that's why we're experiencing the burning symptoms that we typically see. Some of the causes of peripheral neuropathy, as I mentioned earlier: diabetes, prediabetes, poor circulation, toxic exposure like chemical or chemotherapy, neck and back herniated disc, spinal stenosis, post-surgical, autoimmune diseases, infections like viral or bacterial, alcohol abuse, several medications and pharmaceuticals, including the #1 prescribed drug for neuropathy, as well as liver disease, kidney disease, and thyroid conditions. The true science behind neuropathy is pretty straightforward. On the far left, you can see a nerve that's perfectly healthy and functioning normally. But over time, because of loss of blood supply or reduction of blood supply, loss of nutrition, and a low nitric oxide production, you're going to see that the nerve itself will start to become dysfunctional and eventually will end up in a degenerative state. And that's when we're really progressing through our neuropathy. Amputations is a fact that's associated with neuropathy. Most people don't associate with that, but each year in the United States of America, there's about 86,000 neuropathy-related amputations. It's one of the most feared complications of the disease because you literally can't feel your feet. In this case, this individual was a client of ours. He had stepped on a nail at work. It went through his boot. He had no idea. He couldn't feel anything in his feet, and when he came to see us, his toe looked horrible. He had it taped together next to the other toe. We sent him off to the doctor's office, and sure enough, they cut off his toe. So amputations are a serious problem. In addition to that, numbness can always affect others as much as it affects ourselves. And here's an example. This was a picture sent to me by a colleague of mine who's doing the same type of protocol. I taught him my protocol so he could implement it in his office. This is a picture of the office building that he's in. A lady was coming to him for a neuropathy seminar. She couldn't feel her feet at all. She stepped on the gas instead of the brake and crashed into the building. So you can only imagine if she was trying to stop her car at a crosswalk full of kindergartners on their way home from school or something like that. So numbness can really affect others as much, if not more, than ourselves. Falls are also a part of the problem with seniors. 1 out of 3 adults fall over the ages of 65 each year. 20 to 30% suffer moderate to severe injuries. 10% of those falls are fatal. And it's a leading cause of injury deaths over the age of 65. So what are your choices? Do nothing. It'll only do what? It'll only get worse. You can live with it. I hear that a lot. Patients say, well, my doctor told me I just have to live with it. And it will only get what? It'll only get worse. Lastly, you can go to your primary doctor or a neurologist, and they'll give you drugs. And it will only get? Exactly. It's only going to get worse. You see, all the drugs used for neuropathy out there today only mask the symptoms. They don't correct the underlying cause of the neuropathy, and that's what's so different about our program, and that's why we have such a high success rate, because we're really addressing the underlying cause of the neuropathy, whereas the drugs are only masking the symptoms. If we look at Gabapentin and Neurontin, these are the most common drugs that are prescribed. Some of the side effects you'll see here, from blurred vision to peripheral edema, tremors, weight gain. There's a bunch of things. But look at the side effects down here. Look at this. it'll actually give you neuropathy. So they're giving you a drug that one of the side effects is neuropathy, which is totally backwards in my opinion. Neurontin was initially designed and developed as an anti-seizure medication. It slows down your brain so you don't feel your feet. And of course, it doesn't stop the neuropathy's progression. Lyrica, same thing, swelling. We're going to see suicidal thoughts, increased risk of cancer, increased risk of bleeding, irregular heartbeat called AFib today, muscle pain, rapid weight gain, and then severe dizziness. What do we do at functional medicine in our office? Well, it's pretty straightforward. The difference between what we're doing and what the medical doctors are straightforward. We address the underlying cause. Your medical doctor will give you drugs that'll mask the symptoms. This is one of my favorite slides. In the United States of America, we consume 75% of all drugs manufactured on the planet every single year. Why is that important? We only make up 5% of the world population. So when it comes to being over-medicated, the answer is yes, we are being over-medicated. 5% of the world population, we're consuming 75% of all drugs. There has to be another solution, and that's what we're here to talk about today. We have a solution for you. When is it time to take action? Well, in my opinion, it's time to take action now. I'm grateful that I took action when I did, eliminated my neuropathy back many years ago, and so today I'm living neuropathy free. So for you, the time is now. The longer you wait, the harder it is to reverse. The National Institute of Health says the following: peripheral nerves have the ability to regenerate. There it is, regenerate, as long as the underlying nerve cell has not been killed. So this is pretty straightforward what we're doing. We want to make sure we're working with people who have 85% or less nerve loss. When should I take action? The time is now before you surpass the 85% nerve loss. Resolving the underlying cause before it's too late. One of our clients came in to see us. After 5 treatments with Dr. Rappy, I can feel my feet again for the first time in over 2 years. I'd been seeing another doctor in town for over a year and spent thousands of dollars and absolutely no results. Dr. Rappy is the real deal and his program really works. We call it the 3 R's program. The 3 R's program for neuropathy is this. First, we want to resolve the underlying cause. Second, we want to rebuild the capillary beds to increase blood flow. And third, we want to regenerate the nerves. How do we do this? First, we're going to resolve the underlying causes utilizing nutrition and supplementation. Second, we want to rebuild the blood vessels and increase the blood flow. Low light level therapy was introduced by NASA. It was developed to speed up cell regeneration. And what else did NASA say? Well, the treatment with red light reduced pain and sped up the healing in humans. Cell regeneration was faster. It showed an increase in blood flow, promoted new blood vessel growth, which is really important, and increased the nitric oxide production in the body. Lastly, we've got to regenerate the nerves. The way we do that is we use cutting-edge electrical nerve stimulation technology that re-educates and rejuvenates the nerves that are dysfunctional. Do we have a proven method? I say yes, we do. There's over 2,000 published studies on the effectiveness of low-light laser therapy as well as electrical therapy. Dr. Rappy has over 30 years experience treating human tissue with lasers. Cancer Centers of America said this: in the past, we've used traditional physical therapy, electrical stimulation devices such as TENS and interferential current. The Rebuilder system provides our patients with chemotherapy-induced peripheral neuropathy the best and longest-lasting pain relief. A remarkable 96% success rate. Patients have reduced or stopped taking their pain medications such as Gabapentin and Lyrica.
Hi, I'm Jim, and I've been coming here to Dr. Rappy's neuropathy program here for, about 4 months now? So I've been following the supplements and scheduling here at the office. Also do all my home therapy too. When Dr. Rappy did the last follow-up, my vitals improved by over 80%. When I came in, my feet fell asleep. It would wake me up at night. I couldn't walk on many things. I couldn't even walk any place without shoes on. Now I can walk on almost everything, even the hard cobblestones that I always had trouble with.
So why doesn't your doctor know about this? Well, it's pretty straightforward. Medical students receive an extensive education in pharmaceuticals and how to use the pharmaceuticals to suppress your symptoms. That's the number one tool in their toolkit. In addition to that, medical students receive less than 20 hours of nutritional education over a 4-year period of school. And lastly, medical students receive no education on alternative medicine. So literally, they practice what they were trained to practice in school, which is to give drugs to minimize your symptoms. Freedom to choose. Freedom to choose is pretty straightforward. The choices are the foundation for your health. Past, present, and future. So moving forward, if you really want a different outcome, you've got to do something different. And that would be making better choices. Failure to take action and do something different will lead to the same outcome, which we know is prescription drugs from your doctor to minimize and suppress your symptoms. What our program is and what it's not a 7-minute chat with your doctor who has no solution other than to provide drugs that only mask your symptoms. Our program is pretty straightforward. We do a comprehensive consultation with a certified functional medicine practitioner, a comprehensive 16-point custom neuropathy examination with a doctor who's completed a board certification course in neuropathy, and then we want to determine the percentage of loss. If we determine that you have less than 85% nerve loss, we have a solution for you, and our success rate is very, very high. I show this because we do see a lot of people with Medicare. Medicare really doesn't cover a lot of the things that we believe they should. Let me give you a quick read on this. Medicare Guidelines 2251.3 states that a treatment plan that seeks to prevent disease, promote health, and prolong or enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition is not medically necessary. So Medicare doesn't pay for these kind of programs, which is unfortunate, but that's just the way it is. It's an investment you need to make in your future. Imagine for a moment if you were able to sleep peacefully through the night, if you were able to walk with confidence and feel steady on your feet again, getting back to your favorite activities like golf and tennis and pickleball, walking, hiking, biking, or whatever your activities happen to be, travel and enjoy your family outings again, and not have to take drugs that are just going to mask your symptoms. Just imagine any of these for a moment. How wonderful would that be?
My name's James McKee. I come to the desert for 5 to 6 months a year. Last year, 2018, I happened upon Dr. Rappy, went to a seminar and was impressed with the techniques being used. And prior to that, I've been taking nerve supplement pills and a prescriptive for Peripheral for restless leg, cramping, and to calm my feet. They were very tingly, real numb, and almost to the point of painful. So this program has provided me a way out. It works. I've been coming 5 times in 2019, 2 times in 2018 towards the end when I first came here. And right now, sitting here at the middle of January 2019, my neuropathy in my feet and the restless leg is kind of gone. It's absolutely amazing. I'm sitting here and I can feel my feet on the bottom for the first time in 7 years, and there's not a lot of tingling. Still there, noticeable, but like if I don't think about it, I don't notice it. And prior to that, riding in a car, sitting at a table in a movie, I'd have to get up and leave sometimes and walk on a quick way to get the restless movement out, and the tingling and the numbness was always there. This seems to be, I've had a noticeable change after the last 5 visits, and using my tub at home for the stimulation, electrical stimulation, the drink that's been provided for me, and the procedures in the office have, I'm sold. It's working. I'm going to continue to do this because I don't want to go back. And Dr. Rappy said, you're really advanced in this, so we need to get on it. And get on it I did, and it's working. I'm very pleased.
So think about for a second, what are the most important things to you? Whether it's being able to take part in social activities, go on trips with your kids, or make memories for your grandkids, whatever those happen to be. Dealing with your neuropathy, helping you to reverse your neuropathy will give you a lot more of those. And so we want more of the things that we really enjoy and are the most important to us. Thrive Functional Neuropathy Center, it's pretty straightforward. We do a comprehensive consultation with a certified functional medicine specialist, 16-point custom neuropathy examination with a doctor who's completed a board certification course in neuropathy. We provide a solution and a plan of action. If it looks like this program is right for you and you qualify, We'll definitely go down solution and plan of action. My normal fee, that consultation is $287. But because you listened to this program today, I have a gift for you. And my gift to you today is pretty straightforward. We're going to reduce that down to a simple $87. I don't want there to be any financial barriers for anybody to come in and see if they actually qualify for this program that could literally change their life, give you back the life you used to have.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
So if you want a different outcome, you just got to do something different. It's straightforward. We have an incredible program in our office. It's proprietary to my office. It's been developed over the last 30 years. So if what we said today in this little program makes sense to you, contact us at the following information. Website, thrivefunctionalwellness.com, Facebook, Thrive Functional Wellness Center, and Instagram, Thrive Functional Wellness Center. Call our office at 760-777-4177. Thank you very much and have a great day.